Did you know that within the cells of your body, there's enough DNA to reach the moon? Your body contains an amazing amount of information, including vital information that can help you prepare for having a family. At Myriad, we want to make sure you have access to this information so you can make choices that are right for you and your growing family. My name is Leanne, and I want to talk to you about carrier screening as a part of preparing for your family. You can think of carrier screening the way you might think of an X-ray. Just like an X-ray allows us to take a closer look inside your body, a carrier screen allows us to take a closer look inside your cells, at your DNA. By studying certain pieces of your DNA, called your genes, we can tell you the chance of having a child with a serious health issue. Most of the time, we'll find that the chance is low. If we find that your chance is higher than expected, it's important to know that there are many ways to use this information. In the next few minutes, I'll go through a few more details about Myriad's carrier screen, which we refer to as the Foresight Carrier Screen. The Foresight Carrier Screen can detect conditions that can be passed unknowingly from parent to child. The impact of some of the conditions on the Foresight Carrier Screen can be reduced if treatment is started early in life. These include Wilson disease and PKU. Other conditions cause lifelong symptoms and reduce lifespan, such as cystic fibrosis and Bloom syndrome. Finally, some of the conditions have limited or no treatments available, like Tay-Sachs disease and Canavan disease. The entire list of conditions that can be included in the screen can be seen at myriadwomenshealth.com. Your healthcare provider may only test you for a subset of the conditions on the Foresight Carrier Screen, so it's important to understand what's included in your specific panel. It's always a good idea to research your family history. Even if nothing turns up, which is often the case, keep in mind that many of us are carriers and simply don't know it. In fact, many children with genetic diseases are born to parents with no known family history. A positive test result means that you are a carrier. Let me take a moment to explain what that means. Genes are inherited in pairs. You get one from your mother and one from your father. A carrier is someone who has one gene with a change, which we call a mutation, and one gene that's working correctly. As long as one gene in the pair can do its job, carriers are typically healthy and do not have any signs or symptoms of the condition. The good news is that most of the diseases included in our Foresight Carrier Screen occur only when both parents are carriers of the same disease. This means that you and your partner would have to be carriers of the same disease in order to have an increased chance of having a child with symptoms. Less than 5% of men and women who undergo carrier screening end up being positive for the same disease as their partners. There is a much higher chance that you will be positive for different diseases or simply test negative. If you and your partner are found to be positive for the same disease, there is a 1 in 4 or 25% chance of having a child with that disease. There are some exceptions, like Fragile X syndrome, where only the woman needs to test positive for there to be an increased chance of having a child with the disease. If the Myriad Foresight Carrier Screen shows that you are at increased risk of having a child with a serious disease, it's important to understand that you have options. Our genetic counselors are available to guide you through the various options or refer you to a local expert who can help you figure out what's best for you. Like any carrier screen, the Foresight Carrier Screen reduces but does not eliminate the chance of having a child with a serious health condition. In general, carrier screening is covered by most insurance policies and only requires a small blood or saliva sample. Please speak with your doctor if you have further questions or visit myriadwomenshealth.com.